Hey, everybody, and welcome to another edition of the Migraine Mentors Mini-Guest. I am one of your hosts, Dr. Eric Rees, here with my colleague, Dr. Thompson Maisaka Thompson. Happy Monday. How are you today?
Happy Monday, man. I don't know where all of you are listening from, but it was -8 degrees when I let my dog out this morning, so I am a little nippy, but
Yeah,
overall pretty good. How are you?
I'm good. The tropical paradise that is Minnesota. All of the things that come with that. And for those of you who struggle with migraine, cold can be your friend. Cold can also be a massive enemy of yours as well. So we're here just battling the elements, bringing you the knowledge and information you're seeking today. Thompson and I were just talking before this about kind of just some things that have come up recently with patients and discussions, and something that we really haven't touched on a lot yet that is really relevant to the migraine community is your eyes, the visual system, and migraine. And I'm not just alluding to like whether or not you get an aura. There's just so much more to uncover with this. Thompson, you actually had a phenomenal case roll through our clinic over the last week or two, dealing with vision, vestibular issues, so dizziness, and then migraine symptoms. Do you maybe just want to start off talking about that patient and just kind of their presentation and what you ended up being able to do with them?
Sure, yeah. This, in terms of a case that presents with everything that we treat, this was about as good as it gets. So she is a 29-year-old professional, had migraines her whole life up until 3 years ago when she got in 3 car accidents, pretty much back to back within
Wow.
a month of each other, three in a very close period of time. And she developed some post-concussion issues, which then poured gasoline on her migraine frequency. So she went from having, I don't know, a handful a month to literally every day. She would burn through her abortive medications the first 9 days of the month and just kind of hold on and suffer from then on. She would get migraines super early in the day. She had a lot of issues with very busy visual stimulus. So basically anything working on a computer was
Mm.
kind of out, and that was her main job. So it made life kind of challenging. Super dizzy, motion sick, terrible neck pain, traps wound up to here, shoulders right in line with the ears, the whole thing, every symptom and everything that could cause one pretty much did. And so the process to fix it was, it's going to sound weird, but it was pretty straightforward. The first thing that we did was just lay out the dietary guidelines. We talked through some histamine stuff, and she immediately overhauled her entire diet without any hesitation and immediately cut her migraine frequency in half, which, if you're listening out there and you haven't tried that yet, you should.
Mm-hmm.
And then we just went very methodically through the process that neuro rehab tends to follow. Is If you're listening out there, we basically just start at the very bottom of your brainstem and work all the way up to your brain, and different functions kind of happen along that course. So one of the things that probably the hardest aspect of her care was we do this test in our clinic called a VNG, where it records your eyes and essentially gives you a score out of 100 to tell how good your eyes can do these things. And you'll often find people, as we're doing the test, as you can see it kind of racking up a bad score, their symptoms will come up immediately. They'll say, "Oh my God, I hate this. This is making me super dizzy. I don't like this." I've had a couple people even pass out or vomit during it. So it took us quite a bit to actually get enough momentum to break through those. And when we did, that was when her migraines went from, at that point, they were happening about half the days. And once we cracked the visual system errors that were occurring, they went down to one or two. She was able
Awesome.
to pretty quickly abort with her medication. And so when you look at the eyes, as you know, Eric, if those things don't function well, they can bring about a smorgasbord of unpleasant issues.
And essentially, the issues that most people complain about in the first place, right? Double vision, blurred vision, disconnect, fatigue, dizziness problems, like concentration and focus issues. I mean, any neuro-ophthalmologist will tell you that those are common symptoms of people with a strabismus or a heterophoria. These are all just big terms meaning that your eyes are not aligned, right? So, um, when you take a look at understanding the visual system, I mean, up to 50% of your brain is involved in vision in some way, shape, or form. And I'm going to let people sit into that for a second. your eyes are a massive window into the brain. And we're not talking just about the hardware, like the eyeball itself, the physical eyeball with your cornea and your retina and the lens and all of that. Thompson and I are talking about all of the software, but like from your retina all the way to the back part of the brain, which allows you to do really basic, really simple things like fixate your eyes on my thumb, just literally tracking my thumb, whether it's horizontal or vertical, like choosing to choose between one thumb versus the other and making these fast eye movements called saccades. It's putting all of that together to understanding what works and then what doesn't. And Thompson mentioned the VNG. This is something that we, really kind of live, eat, and breathe is objectively quantifying eye movements, showing people when they don't work well what they should look like, and then rehabbing the brain to get to the point where they do work well and they work together. Um, Easier said than done, always. But to Thompson's point and to his methodology as well, he went after the diet and did a ton of early work to kind of dig the well and prehab that patient to get them ready for it. And Thompson, I think that's probably why you did such a good job with her case. Not only are you just a great doctor in general, but you listened to her, you understood what she needed, and then you went after it. And so, with that said, I'm curious for those out there who are listening to this, who've had migraines for years, but they're like, "Oh, I got my eyes checked by my optometrist, and my eyes are fine." Like, what do you have to say to those people who've been like, kind of maybe not necessarily miscared or mismanaged, but they haven't had all the evidence pointed to them to show them where they could go?
Right. And I think a huge part of that goes back to the pitch that we give everybody that comes into our clinic is you're going to, if you're starting right now to venture off into the sort of holistic management of these things, it can get super confusing
Mm-hmm.
because healthcare in America is super siloed. Case in point, to your question, Eric, an eye doctor will test how your eyes see. An ophthalmologist or neuro-ophthalmologist will help you understand how they are aligned. So if you talk to a normal person, like, hey, when was the last time you got your eyes checked? Most will assume, oh, I see fine and my prescription is accurate. Then you follow up with a simple question of, well, what did they do to make sure your eyes are aligned well, or they see the same thing, or they see at the same depth, or they track smoothly, or jump from one thing to another thing accurately. Even everything I just listed could be broken down into 2 or 3 different types of specialists.
Yeah.
So that's the one thing I would recommend is just familiarizing yourself with the different kinds of eye specialists out there. Yes, it's good to see things accurately, but if one eye is like focused out here and the other one is straightforward and your head is constantly like this, that might cause some issues.
And a great reason why I get so frustrated when patients are sent to our office and they've seen all the chiros, right? They've seen all the PTs, they've seen all the, massage therapists, myofascial release prep providers, and they're like, I still have neck pain, or like, and I look at them and they're like, heads tilted like this, one of their eyes is up, they can't track well, and I'm like, well, it's not the neck. The neck is the outcome, right? The visual system in the brain is always what is trying to set the tone. And you see it just as often as I do when you're doing exams, when you're seeing patients. Your eyes are just a massive component to overall health. And they're really relevant to migraine too, because there's a lot of cases that we get in the office where they either have had migraines for most of their lives and they haven't had the history of trauma or concussions like we're used to, or they do have a history of trauma and they're like, yeah, my migraine symptoms used to be like this and now they're like this after the car accident. We see those. And so when you know too much, for lack of a better term, when you know like what the possibilities could be, now you can't go back. Like I'll never see a patient and just be like, oh, we're only going to do soft tissue with you, or we're only going to do like a chiropractic adjustment with you. I can't do that anymore because now I know that the eyes and the inner ear system are so intimately linked to that it's just a non-negotiable for me. So those cases just continue to come through, and I'm hoping more people listen or more patients are at least aware to know where to go. But is there any advice you'd give somebody who is confused and they're like, I've tried all these things and nothing's worked, or I've seen all the doctors and nothing's worked? Like, how do you split that apart with patients that call into the office to talk to you?
Yeah, I mean, the short advice would be just give one of us a call. We'd be happy to chat with you. We're not going to tell you to come into our clinic regardless of what you say to us. We're actually going to sit and listen to what you have to say and help you find the best next thing.
Yeah.
I would say also a big aspect of finding this type of care, at least finding relief in the alternative world, is to set your expectations up in a way that's going to allow you to succeed. It usually ends up being, with the rare exception, pieces of several different providers that ultimately add up to feeling substantial relief, and not so much, I just tried one thing and immediately felt better. That's a story I hear almost every
Mm-hmm.
person that comes in, is
Mm-hmm.
when you're in the medical model, the expectation is the doctor's going to give you this one drug, and the drug is supposed to help everything that you have going on. That's the expectation. That's probably how it's worked with other conditions you've experienced in the past. With migraine, as multifaceted as it is, when you move out of the medical space, you should not go into these appointments with the expectation that any one thing is going to solve all your problems or make this
Yeah.
huge dent.
Yeah.
Unfortunately, it's kind of a methodical process in which you find little pieces of relief, install those into your life, have them run on autopilot, or habits, if you will. They give you relief over time, and then you just accumulate a bunch of them, and it helps. We can help speed that up for you by identifying what those habits should be, which is why I would recommend you give us a call, because we see this stuff all the time. But I think that mindset going into all of this is probably the most helpful thing I can give you without talking to you. It's sometimes just a little bit of a paradigm shift that helps people get into the right headspace. What would you
The
say
setting
to
of
someone?
I mean, I don't even know if I would add anything to it. I think setting expectations in the earliest part of a conversation is so underappreciated and underutilized. I'm like, when I take a consult, I just did one a little bit ago with a woman who's in Mississippi, and she just feels like she's in like a healthcare kind of desert. She's got no help, no resources, and she's like, I don't know what to do. And I was like, well, try X, Y, and Z. Like, move through, and go see this person, talk to this kind of doctor. Like, you haven't had this done yet, you have had this done. And I was like, I don't even know if you're a match to come see me. Like, maybe after you've exhausted your local resources and you've tried these things and you've done all the work, like, it's kind of a bigger event to come hang with us, and that's fine because it works so well for so many people. But the reason it does is that we do all of the work on the front end to say, here are the labs to run, here are the expectations to have, the low histamine diet, whatever kind of things you're going to do to get somebody ready to handle what we're going to give them is huge. And just, I think making sure that patients are educated is probably the biggest thing that I've seen be the Achilles heel for the entire system, is that patients want to know this information. They're just so caught up in the big doctor terms we all use. And we're as guilty of it, and we're even aware of it, right? Like, of trying not to use those terms to describe something in a way that's not belittling, but it's able to communicate what you need to know and understand. I still struggle with that. Thompson, I think you're probably better at it than I am, but I know you and I have gone back and forth on that about, like, whether it's website, copy, marketing, newsletter, like, just being like, how do we make this more simpler and easier to understand? And I think that that's a big
100%.
problem for us. Yeah.
It's so hard, man. We spent like what a combined with undergrad and graduate school and all the specialty, like 11 years trying to
Way too long.
accumulate this information. And the only lesson you learn when you get it and start applying it is simplify it. And you're like, I just spent all that time trying to learn it. That's totally on us. And to that point, Eric, I think anyone listening right now, they kind of, at least if I was listening, I'd be like, okay, I know the eyes are involved, and I know it's hard to find a specialist, but what the hell did I do with all this? So here's what
Yeah.
I would do. If you are unsure as to whether or not your eyes are contributing to your headaches or migraines or whatever you have going on, let's run a couple real simple tests. The first one, hold your thumb all the way out in front of you and bring it right up next to your nose so you're cross-eyed, and then bring it out. Do that like 10 times pretty quick. Note if it gives you symptoms. Then hold two thumbs out right at ear width, just like Dr. Eric's doing. If you're not doing it, he's just got his thumbs, one on each ear, extended out in front of him. Move your eyes real quick, back and forth, back and forth, back and forth, back and forth. Do that for 10 seconds. Do the same thing up and down with a thumb on your forehead and on your chin. Then extend those out, up and down, up and down, up and down. Note if it gives you symptoms. Last one thumb, just follow it side to side in front of you and up and down. If all of those, or at least 3 of them, made you feel uncomfortable, made your neck lock up, made you nauseous, gave you symptoms, triggered a migraine perhaps, probably a good chance that your eyes and their inability to perform what they need to is a contributor to your migraine frequency, in which
Yeah.
case you would want to go see probably a just Google vision therapy near me or neuro-ophthalmologist near me, and just get that process started. Because if that is one of the drivers in your presentation, you use your eyes so much, it's so hard to function without them, that fixing those things will pay dividends
Yeah.
forever.
There's a reason you have two of them, right? So they got to work together as a team. And if they aren't, then you're kind of stuck. So yeah, that's a really great spot for us to end this as well. Thompson and I can talk for way too long about eyes, and they're not exactly the most entertaining thing to talk about at the dinner table. So we try not
Disagree.
to be those guys at the parties, but we will be doing neuro tests on people if we think that they're suspects. So, but thank you for all of you who joined us today. Once again, we are the Migraine Mentors. This is a Migraine Mentors mini cast that we always shoot every week to the adjunct of our Migraine Mentors newsletter. If you are somebody who is a subscriber, we thank you so much for supporting us. If you're not a subscriber yet, go click the subscribe link in the YouTube channel description below. We hope you join us again for another session. If you do have questions or comments, leave them, shoot us messages, emails, or give our clinic a call at the Neural Connection in Edina, Minnesota. And we'll see all of you at the next session.